It's a habit so simple, so basic, that most people don't even think twice about it. You wake up, stretch your arms, and maybe reach for a glass of water. But what if that innocent sip is actually doing more harm than good? What if the way you drink water in the morning, something you've done for decades, has hidden dangers after 60 that could hurt your heart, kidneys, digestion, or even your brain? Most seniors already know that staying hydrated is important. It helps keep your joints cushioned, your skin from drying out, and your blood flowing smoothly. But what's rarely talked about, and what most doctors don't mention, is that the way you hydrate matters even more as you age. Seniors face unique challenges: slower metabolism, weaker kidneys, reduced thirst signals, and more sensitivity to changes in blood pressure. That means something as basic as how, when, and what you drink in the morning can either heal your body or stress it even more. And here's where the truth gets uncomfortable. Millions of seniors are making 5 common mistakes with their morning water routine, and they don't even realize it. These mistakes seem harmless on the surface, but over time, they can contribute to chronic fatigue, bloating, blood pressure spikes, and even dizziness or fainting spells. If you've ever felt lightheaded after getting out of bed, if your mornings start with sluggishness, or if your digestion seems slower than it used to be, one of these morning hydration habits could be to blame. Let's begin with the first and most dangerous mistake: drinking ice-cold water right after waking up. It might feel refreshing, especially in warmer climates or during hot summer months, but for seniors, ice water can shock the system. When you're over 60, your digestive tract is more sensitive, and your stomach lining becomes thinner and more prone to irritation. Ice-cold water causes blood vessels in the stomach to constrict, slowing down digestion. It also triggers a mini stress response in your nervous system, which can interfere with your heart rate and blood pressure, 2 things that are already harder to regulate with age. Seniors with acid reflux, indigestion, or a weak appetite might notice they feel worse after drinking very cold water in the morning. Instead, lukewarm or room temperature water is the better option. It gently awakens your digestive system and hydrates your cells without shocking your body into a defensive state. The second mistake many seniors make is drinking too much water all at once in the morning. Some believe they're being proactive by chugging a full liter as soon as they get out of bed, but this can actually overwhelm the body. After 60, your kidneys don't filter as quickly, and your heart may be less efficient at managing sudden shifts in blood volume. Downing a large amount of water quickly can lead to something called water intoxication, or hyponatremia, where sodium levels in your blood drop dangerously low. It can cause nausea, headache, confusion, and in severe cases, seizures or loss of consciousness. Seniors are especially at risk if they're also taking blood pressure medications or diuretics. A safer and more effective habit is to sip water slowly over the course of 20 to 30 minutes after waking. This allows your cells to absorb the water gradually, helping your metabolism, flushing toxins, and rehydrating your organs without overloading your system. Mistake number 3 is drinking water before taking care of your mouth and gums. This might surprise you, but your mouth is full of bacteria when you wake up, especially after age 60, when saliva production drops and oral health becomes harder to manage. Seniors often struggle with dry mouth, receding gums, or dental issues. Overnight, bacteria accumulate in the mouth, and if you drink water before rinsing or brushing, you're essentially sending that bacteria straight into your gut. This can contribute to gut inflammation, bloating, and even immune responses that worsen existing health problems. It's always best to rinse your mouth with warm water or lightly brush your teeth before drinking anything in the morning. This tiny habit shift protects your digestive system from being exposed to unnecessary germs and lowers your body's inflammatory load. The fourth dangerous mistake is relying on plain water without any minerals. As you age, your body's ability to retain essential electrolytes, like potassium, magnesium, and sodium, declines. And when you drink only purified or distilled water with zero minerals, it can actually dilute the mineral balance in your bloodstream. This can leave you feeling fatigued, dizzy, or mentally foggy. Seniors with heart arrhythmias or blood sugar imbalances are especially sensitive to these shifts. While clean water is important, adding just a pinch of sea salt or a squeeze of lemon to your morning water can make a huge difference. These simple additions replenish lost electrolytes, help your body absorb water more effectively, and jumpstart digestion. If you take blood pressure medications, always check with your doctor before increasing sodium, but for most seniors, these tiny adjustments provide energy and stability that plain water simply can't. Now for the fifth and final mistake: ignoring your body's signals and skipping water altogether in the morning. Many seniors wake up and head straight for the coffee pot. And while that first cup of coffee feels comforting, caffeine is a natural diuretic. It pulls water out of your system and sends it to your bladder before your cells can use it. If you start your day with coffee but skip water, you're beginning your morning in a state of dehydration, which can lead to joint stiffness, headaches, poor concentration, and even higher fall risk due to slower reflexes. What makes it more dangerous is that older adults often don't feel thirsty, even when they're already mildly dehydrated. The signal that says, "I need water," becomes weaker with age. That means hydration needs to be proactive, not reactive. The best practice is to drink a glass of warm water before your coffee. This helps line your stomach, protects your kidneys, and wakes up your digestion without the crash that caffeine alone can bring. So, what's the right way for seniors to drink water in the morning? It starts with mindfulness and intention. As soon as you wake up, sit up slowly and take a few breaths. Then rinse your mouth gently or brush your teeth before anything touches your stomach. Prepare a glass of room temperature or warm water, about 6 to 8 ounces. Add a tiny pinch of mineral-rich sea salt or a splash of lemon juice if you'd like. And sip it slowly over 15 to 20 minutes. This simple ritual will lubricate your joints, cleanse your digestive tract, support your liver, and balance your blood pressure naturally. Only after this should you have your coffee or medications. Remember, your body has been fasting for 6 to 8 hours overnight. Your cells are dry, your blood is thick, and your kidneys are working double time to eliminate toxins. If you skip water or do it wrong, you're starting your day with stress and strain. But if you hydrate wisely, you're giving every organ in your body, from your brain to your bowels, a gentle wake-up call that sets the tone for better energy, better focus, and better digestion throughout the day. Water is life. But like any medicine, it needs to be used properly. Especially after 60, when every choice you make can either add years to your life, or quietly take them away. If this video helped you rethink your morning routine, we want to hear from you. What's your current habit? Do you drink water before brushing? Do you notice any difference when you hydrate first thing in the morning? Leave a comment and share your experience. You never know who you might help. And if you'd like more science-backed tips designed specifically for strong, smart, and healthy seniors, be sure to subscribe and hit the bell. We're here every week, helping you live not just longer, but better.